My name is Dr. Harishkumar. I am currently working as the professor and head of Department of Endocrinology at the Amrita Institute of Medical Sciences in Kochi. I am doing this video on behalf of the Professional Association of Clinical Endocrinologists, which is an organization known as PACE, which represents all the practicing endocrinologists in Kerala. Today I'm going to talk to you briefly about the importance of controlling blood sugars prior to any kind of surgical procedure. Now, the first thing to understand is, why is it important to actually control your blood sugars tightly before a surgery? The second thing that I'm going to talk about is, what sort of target levels are we looking at? So there are a lot of studies which have shown that if your blood sugar is controlled tightly prior to surgery, then it will reduce the risk of post-operative infections and other post-operative problems as well. So in the run-up to the surgery, adequate blood sugar control must be there. In fact, the anesthetist frequently sends patients to us for clearance before surgery if their blood sugars are not adequately controlled. And then we look at some tests, that is what is the fasting sugar, what is the postprandial sugar, and another very important test called the HbA1c, which is the average blood sugar for the last 3 months. Numerous studies have actually shown that people who go into surgery, diabetic patients who go into surgery with well-controlled sugars, do much better. The surgical outcome is better, post-operative complications including infections are less, and even if the patient has to be in ICU for a period of time, then the associated complications and even the duration of stay in ICU will be reduced if the patient has got good diabetic control. If it's a very major surgery where even mortality is a possibility, again, the risk of mortality is substantially reduced if you go into surgery with adequately controlled blood sugars. Now, what exactly is adequate control? I think if you do random sugar, because frequently patients are sent to us for an opinion maybe just few days before the surgery, so we would look at a random sugar. If it is like less than 180, that is fairly satisfactory as far as that is concerned. But the more important test is the HbA1c, which tells me what your blood sugar has been for the last 3 months. In general, if the HbA1c is less than 8%, that is decent control. Less than 7% would be ideal. Less than 8% would be fairly all right. And studies have shown that patients who undergo surgery with HbA1cs of less than 8% generally tend to do fairly well. And so I would pass such a patient or give clearance for surgery for a patient with very low risk. If, however, the blood sugars are very high prior to surgery, then as an endocrinologist, I would have to consider whether we could actually reduce the blood sugars adequately before taking up for surgery. If it's an emergency surgery, obviously we don't have the time and we have to go ahead. I would then state that the risk during the surgery and the post-operative period is higher. However, if it is not an emergency, it's an elective surgery, then I would ideally like to get the blood sugars down to the target values as close as possible. Then comes the question of time. Supposing the surgery has to be done within 2 or 3 weeks, it's a very major surgery. The physician, the surgeon and the relatives have all made arrangements, and it would be very disruptive if the surgery is not held on the given date. Then maybe we could go for tight control of the sugars with insulin, and then if the sugars are reasonably controlled, we can take up the patient for surgery. But ideally, if it's an elective procedure, for example, a cataract surgery, and the HbA1c when I see the patient is 10%, and that's way too high. So I would like to wait for 2 or 3 months, intensify the diabetes therapy, control the patient's diet better, get the HbA1c down to the target level, and then take up the patient for an elective surgery. However small the surgery, however minor the surgery, the risk of complications and postoperative infection is always greater in patients who have uncontrolled diabetes. So the message that I'd like to leave you with is that proper control of diabetes in the run-up to a surgery is very important. And if you can achieve that target, then the outcome of the surgery, the perioperative period, the post-operative period will be very much smoother. Thank you.